So my name is Stephanie Brashear. I'm one of the trainers with the Quality Alliance. Just a little bit about my history. I was an MA for about 4 years in an internal medicine office. Then I moved over to the Cleveland Clinic Employee Health Plan side to help patients, or we call them members, manage their chronic diseases. So the ACO measures, these are based on the 2016 ACO measures, which have changed a little bit for 2017. But just to give you a heads up, so these two are combined, the next two slides. So we're looking at the poor control of hemoglobin A1C, which is greater than 9. In 2016, this was an inverse measure. And now it's combined with the diabetic eye exam. So it's the 27 and 41 for 2017. So this is just looking at making sure the patient is having their eye exams performed. And to keep in mind, the ACO measures are based on a calendar year, so they're for 2017, whereas the QA measures are always a rolling year. So it's a year back from the date that you're observing. So our QA measures for diabetes, so basically all of the measures have the same denominator, so they include the same panel of patients. The only ones that are a little bit different is just the diabetes screening, which is not necessarily looking for diabetic patients, but it's looking to identify diabetic patients. And the hemoglobin A1C less than 7 for a selected population is, the age range is only 18 to 64, whereas the rest of the measures is 18 to 75. So the patients are brought into the measure if they meet the following criteria. So they need at least 2 outpatient visits, observation visits, or non-acute inpatient encounters with different days of service with a diagnosis of diabetes. At least 1 patient encounter or at least 1 ED visit, and they also need to be on meds. So if they have the following criteria in the denominator, then we're looking for patients who have a BP reading, their most recent was less than 140/90. So the denominator is also always the panel of patients that are pulled in, and then the numerator is what they need to hit to be compliant, so that's our goal. So we're going to have the same denominator here, so this is just the diabetic foot exam. And then this is the 7% for a selected population, so this denominator, like I said, is a little bit different, just 18 to 64. But we're looking for hemoglobin A1C less than 7, so that's ideal. Next, we have hemoglobin A1C less than 9, so that's the same denominator there. I'm sorry, that was less than 8. Now we have less than 9. And then this one is the inverse measure. So we're looking for the lower the score, the better. So this is going to be the same patients as the 9%. It's just flip-flopped, so the lower score indicates better quality. But we're still looking at the same denominator here. Same thing, same denominator, so we're looking for testing for neuropathy. And the patient is to be seen twice during the measurement year, so again, that's that rolling calendar year. And then the eye exam, diabetic eye exam, so this is similar, this kind of mirrors the ACO measure. And then our references, so included in your guys' packet are the 2 thin booklets. Those are patient information that you could give out. And that's where we got most of our info. Yeah. Yeah. So those can be ordered from Xerox. So we could give you the information on that. And then also in the near future, we're just waiting on a couple things to finalize. We'll have the links on our CCQA website. So you could print, and there's also some individual pages there as well. So if you like a specific page but you don't want to give the whole book, we'll have that uploaded too.